Welcome back. Continuing our coverage of COVID-19 in mid-Missouri. Like we told you earlier, Boone County saw an increase of 42 cases just today. Joining us tonight is Boone County Commissioner Fred Parry. Thanks for joining us, Commissioner. Lots to talk about tonight. Here we are, another week of record-breaking COVID-19 cases. The governor even calling out Boone County this afternoon in regards to the drive in this increase. What's your insight on this?
Well, I think it's just really a matter of us getting back to life as normal. I think some of us have been pretty lax about visiting our favorite establishments and getting out and having contact with family members without really taking the necessary precautions. A lot of people have not been wearing masks. A lot of people have not been sanitizing their hands or respecting the social distance requirements. So, I think this is something that was expected by a lot of people. It is shocking when you look back at especially compared to how well we had done in March and April. But yeah, this is something that I think is just going to be part of the normal course for a while.
Sure. And, a couple weeks ago and even a month ago when we were seeing this increase, a lot of that was probably attributed to the increase in testing that's going on. But is it fair to say now that it's community transmission, people are getting it?
Yeah, over 50% of the cases are really from contact to a known case. About 25% are from community transmission, meaning that they really don't know where they got it. They just got it while they were out in the community. Testing has gone up dramatically in the last couple of days, but that's not really tied to the numbers that we've been seeing for the last week.
Testing sites. Speaking of testing sites, University of Missouri announced today that they're going to open up an additional one next week due to that increased volume. What has your conversations been with the hospitals in Boone County?
Well, I tried to take my son to get tested yesterday at MU Healthcare, and it looked like we were going to be waiting for 2 or 3 hours to get the test. We went over to Boone Hospital. There were only 5 or 6 cars in line, so we were able to get the test, within a half hour. But I think there's just been a big increase in the number of people who feel like they probably need to get a test. There's a lot of seasonal allergies right now with all the moisture that we've had, and so I think some people are concerned that maybe they've contracted COVID when it's just a normal allergy, but people want to get tested.
Hospitalizations, that's something that's starting to go up. We're starting to see that. And of course, that's a big concern, with the hospitals in town. What is your conversation with them been like when it comes to hospitalizations and a possible surge in that?
Well, I think out of the folks that are currently hospitalized, I think today there's 22. And again, only 8 or 9 of those are from Boone County. And really only 4 or 5 of those folks are on a ventilator and only 6 or 7 are in an ICU. So the hospitals all have plenty of capacity. We have a lot of ICU capacity. It doesn't seem like the severity of the COVID cases has been that dramatic. So I'm pretty pleasantly surprised with the lack of increase in hospitalization. So the fact that we're only at 22 and we have so many known cases, I think is a very positive thing for Boone County.
Sure. Starting tomorrow, the city of Columbia is going to have their mask order in effect. I know last week when you came on, you said that Boone County commissioners probably won't take up that sort of ordinance in discussion. Is that still the case?
Yeah, that's still the case. The general consensus is that we have not seen the outbreaks in rural parts of Boone County the way that we have in the city of Columbia. And so thankfully, we don't have to go to that measure in rural Boone County. But it is something that I think probably will make a difference. The more people that we have wearing masks, the less spread we'll have.
All right. Thank you so much, Commissioner, for joining us tonight. We'll be back here at 6.